Good afternoon and welcome to Webinar Wednesday. We're excited to have over 220 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. Today's sponsor, CyberMDX, is headquartered in New York. How many Major League Baseball teams does New York have? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to save the date for our fall MD Expo, which will be taking place at the Hilton Baltimore Inner Harbor from October the 17th to the 19th. We look forward to you joining us for 3 days of learning, networking, and the latest advances in medical technology, products, and services. Registration is now open, and more details can be found at mdexposhow.com. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is, and it is Walter Stevens. Congratulations, Walter. Of course, the correct answer is 2, the Yankees and the Mets. Webinar Wednesday would like to thank our sponsor, CyberMDX. CyberMDX is a pioneer in medical cybersecurity with an IoT solution that delivers visibility and threat prevention for medical devices and clinical assets. The solution identifies, categorizes, optimizes, and protects connected medical devices to help ensure their resiliencies as well as patient and data safety. With CyberMDX, hospitals identify, access, and detect and prevent potential cyber attacks for continuous discovery of medical devices, comprehensive risk assessment, and owl-based containment and response. For more information, visit cybermdx.com. Our presenter today is Safi Oransky, Vice President of Business Development at CyberMDX. Safi, you may begin whenever you're ready.
Okay, thank you very much, Linda. I hope everyone hears me and sees my screen. So first of all, I want to thank you for taking your time today. I'm sure you're extremely busy, but I think it's going to be worth it. Having spent quite a lot of time now with customers, partners in this healthcare ecosystem, we've learned a lot of things. And basically, this is what I want to share with you today. I want to share our insights, some of our research, best practices, and I really hope that by the end of this 45 minutes presentation, you can take away some things with you. Either you can think about some stuff, or hopefully put some of these things to use. But really, what I want is the same as I hear or see these webinars, is for you to take some take notes, and hopefully you'll learn something new. And like I said, after that, we'll have some questions, and I'll be happy to hear questions and feedback. So with that said, let me jump right into what we're going to cover today. So I'm going to talk to you about some of the challenging healthcare ecosystems and changing, things are changing all the time in our world, and definitely in healthcare. One of the major issues we're seeing, and a lot of been talked about, breaking down silos and how that can affect and help. Of course, it's easy said than done, but we'll still a very important thing to do. We'll talk about unlocking the potential of the new technologies, and like I said, some of the research and insights that we've seen, especially with best practices. I'm going to cover a couple of use cases. I think that's the kind of more actionable part of it. So these are real things that we've encountered with customers in the field, and then some kind of give you a kind of a perceive, plan, prevent, like a 3 Ps or something that we put together, and hopefully that's something that once again you can use and take. Of course, this thing will be recorded, and you can reference back to the presentation anytime. Just once again, as a quick background, we're a cyber intelligence company, and we're focused only on healthcare. And that basically, we live and breathe healthcare, and that allows us to kind of get a lot of these insights. So a lot of things I'm going to talk about just are coming from the context of the cybersecurity, or of this very intimate day to day with customers and with their medical device and assets, and that's kind of what you'll hear a lot today. So let's get started. So what's going on in our ecosystem? So I don't know if you've seen some other presentations that I made or webinars. I like to start with this because it kind of shows, on the one hand, how kind of a little bit simplistic, but what forces are changing our industry. So information technology, of course, that's changing all the time, all industries, but has a specific impact on healthcare. Especially as it relates to medical devices and biotech, right, and pharmacy. So a lot of new changes that are coming are driven by technology, and that's good, for the medical device and medical procedures that are happening today. That's really good for, the types of drugs that are coming out today, but also it's impacting healthcare services. So we see more and more, clinics or outpatient services being delivered today at a higher quality, and even, things that are going back to home. So I won't touch a lot about telehealth, but that's definitely one of the things that's happening. Another big thing that we hear a lot, the word artificial intelligence, but in practice, many things now are being impacted by this phenomenon of artificial intelligence, and that once again covers all the parameters that I've talked about, and that will make everything here even better and faster, and will have huge impact. Just to kind of talk about the other side, it will also have sometimes negative impact. When we talk about, specifically cybersecurity, it provides more tools, and like any technology, it can use, to do a lot of good, but there's also, people that are using it to do, the bad thing. So, we need to look at both. And lastly, from our perspective, safety, and when we talk about safety, cybersecurity is the key things in our mind. And just wrapping everything and making sure everything is delivered in a safe way is very, very important. And we'll see it as we go through. So what is the impact on HCM? And I assume most of the people listening in today are coming from biomed or clinical engineering. That's kind of where I'm going to focus today. So one of the biggest challenges in managing medical assets is their pervasiveness. Their availability is everybody's problem, but often no one's responsibility. And I chose to read this because I really like this sentence. And I'm sure you feel it, day in and day out. And I heard it, I think, in Amy, and I took it with me because what's happening in the industry, and I'll kind of go from right to left so you can follow me, but we have a growing number of devices per bed. So if you look at, even 2 decades ago, the number of assets per bed more than quadrupled, right? We were like at 3, 4, now we're at 12, 15, depends, what you count as clinical assets. Sometimes these numbers are even bigger, and it's going to grow even more. So that's a phenomena. It's going to stay with us, and I predict that once again we're going to see more and more devices that are going to support health. At the same time, we have more cyber threats and cyber attacks. Our industry specifically is the most attacked industry, healthcare specifically in the US. And we know there's a lot of people trying to get to patient records, but there's also other types of attacks, and I'll talk about one of them. We recently saw Bluekeep, once again, not directly about healthcare, but puts a lot of our devices in threat. And one of the main reasons for that is this third thing, that our devices remain active 10 years or more, and in some cases can reach up to 20 years. And when you think about it, that by itself creates a lot of issues in and around spare parts, operating systems that are not relevant anymore, hardware, software. All of these things have impact on the patient care that we're all into. And then lastly, because of this, medical device failures or asset failures can now have big impact, right? We have a lot of assets, they're helping us a lot, but if there is a failure for whatever reason, whether it's a cyber attack or some other failure, it can be either a misdiagnosis or mistreatment, and in some cases, it can result in serious injury and death. But that's what we're here to prevent. So, having said all of that, I think one of the key things that I've seen and once again talked a lot about, but it's worth mentioning again, is the need for better alignment. And I was recently, and maybe some of you were also in the AMI conference, and the one before. What I liked is one that one of the sessions was from Doug Preps from Mercy Health, and the name of the session was HTM is for Mars and IT is from Venus. And I really liked it because we see it happening again and again. What is the vast differences and disconnect between various departments in hospitals? And not only are there silos in a hospital, within each department, sometimes we see silos. So within HTM there could be, or IT, sub-silos like information systems or clinical and network engineers and so on. And really what that is causing, it's causing for once again more time to figure out things, being less efficient. If I want to kind of add one more things, and you probably know it, a lot of these departments within the hospitals now outsource. So not only now we're talking about silos, we're talking sometimes of clinical engineering outsourced to a third party, while IT and IS might be in-house. Another hospital we work with is the other way around, where they use a full MSSP, managed security service, by a company, but still taking care of their biomed internally and so on. So I think it's a point to remember, and especially as I talk about what is the objective, right? Like really, when we peel everything back, all hospitals are about providing the best care in the safest environment to patients, right? So we talk about a lot of things that we'll see today, but I always go back to that, right? Like it's really making sure that hospitals can take care of patients in a very safe way, and therefore the breaking down the silos is so important. There are other risks that we always think about when we talk about it. Once again, it's the business or financial risks, whether it's lawsuits or revenue that can happen from inefficiencies, and of course there's these all the indirect risks, like the trust in the system or the brand of a specific hospitals. Once again, if you don't get that patient safety and care delivery as your first priority, these other things will happen at some point. So coming back to HTM is a key in this puzzle, and it's a big puzzle, right? It's ultimately, every hospital is a big teamwork, right? Although we talked about silos, but ultimately, HTM folks are taking a big part in that big objective of securing the patient safety and experience. And they are being pulled in many directions, right? So I talked recently to some folks in one of our customer sites, and they're saying, well, I'm getting pulled by the doctors at the ICU, or sometimes if there's a procedure happening and the devices are not working, it can't happen. So that is my first priority. I put my head down and I make sure it happens. And in that case, they need to work with IT, IS, sometimes management, but really, very dedicated people, understanding that they work in this big team, and they're very important team players. At the same time, we have more challenges, and this is not something new, right? Life is full of challenges. There's always going to be challenges, and what I have here is what I think are the top 6 now that are affecting HTM, and therefore, the entire process. So the first one, we have more inventory, more devices. We're in an M&A environment, which 2 things happen. We get more hospitals under one umbrella, and at the same time, I see the bigger networks or even smaller networks starting to expand outside. So more clinics, more outpatient facilities where specific care deliveries being given are out there, and it's not all in one place. So once again, HCM professionals need to not only, before it was taking care of your hospital, now you need to take care of your hospital and maybe 5 clinics, 10 or 100 clinics. Okay. Data, right? I'm not going to spend too much about time on this, but more and more data, somehow we need to manage it, and we'll talk a little bit more about this later. Complexity, right? So more, we have more regulation. I see nearly 1 or 2 things coming every week, whether it's proposals, where it's new frameworks, bodies, everyone trying to do really good stuff. Once again, like AMI, NIST, you name it, right? But ultimately, I think there's quite a lot of confusion down at the hospital level. And I guess like I said, we're trying to do the good thing, but the news is that that's going to stay with us, and we'll have to keep up with this. I mentioned before the increase in cybersecurity threats. The numbers are growing. I think the last couple of years were somewhere between 100 to 300% growth in attacks and vulnerabilities that are being found. And this, I think, or we did in our research, it's going to probably intensify. There's the ongoing pressure to reduce costs, protect investments. We hear this day in and day out. And then lastly, something that I found to be very interesting, and once again, I spent quite a lot of time recently with HCM, is the whole, kind of day-to-day work, right? So all these things are really big, but the day-to-day, and I called it the troubleshooting, right? How do you find the point of failure? How do you fix it quickly? How do you work with people in a more efficient way? So these are a couple of the things that we're going to answer and focus on in this presentation. So one of the important things that I learned coming from other industries is to look what other people are doing and see where we can improve. But before I get there, I was just looking at some inefficiencies, and this is once again more inefficiencies on the utilization level. But I was amazed to see these numbers, right? Still at this time and age, if you want. So we're talking about hospitals that are holding, this number, 35,000, but could be depends on the size of system you're in. Thousands of SKUs. Sometimes we hear just medical devices could be, 5,000 types of medical devices. And then again, utilization. I haven't heard a specific hospital that knew what their utilization rate is. They might have an idea, but not really. But here we see numbers, right? We're talking about, whether these are correct or relevant to one hospital or another. We're talking about very high inefficiency on utilization. Whether it's somewhere between 25 to 40% and more. Sometimes, things like IV pumps, where we have a lot of, it could go up to 40%. And another thing that I found very striking is once again, going back to inventory, how long does it take to figure out what you have on hand and where is it? Okay, so here it's talking about nurses, how long they're spending every shift to look for equipment. But think about once again, people like you, HTM professionals, when you need to go and service an equipment or you need to go find something that's not working, how long does it take? And once again, from some of the cases that I heard from customers, it sometimes can take hours to find and locate an equipment that needs to be patched or fixed. So with that said, if I look at other industries, at least that I've been involved with, in the last couple of years, what I saw that analytics, automation, specifically, technology has been used to unleash, productivity, profitability, and safety. In our case, I think safety and productivity are the more important. But even if you look at, big industries like energy, right? How you can use IoT and analytics to reduce energy, and there's a big reduction, right, in energy usage overall and emissions. Retail, right? Just take Amazon, Walmart, all the retail. Once again, industries that have been working very hard on perfecting their supply chains, getting inefficiencies out of the system, and providing better services. Financial, of course, using data analytics to provide new services. I don't know if you've heard, but there's a Industry 4.0 now, basically the fourth revolution in industry, and everyone using these new technologies and tools. And what I want to show today, and we're going to talk about, is why healthcare is currently, I think, is lagging behind, and how we can make that change. Because wherever there is a problem or a challenge like what we have in healthcare, there's also opportunities, and that's what I like about this industry. I think there's a lot of opportunities here to make huge differences and get to our objectives. So in order to do this, I think there's three things that are very, very relevant to healthcare specific, and I like to, not to bring too many things. I want to focus on these three. So the first one is automation, and when I talk about automation, we have the nice dictionary example of what it is. But what does it mean for us? Okay, what does it mean in healthcare specifically? So we need technologies, okay, that will do the heavy lifting and get the right data at the right time to the right people. Okay, that's nothing new I'm saying here, but we just need it. We don't have it today, or not enough. We need to allow people to make faster decisions and better decisions. It should save time and labor, and I'll give some examples later. We should increase the coverage, right? So today, sometimes you have systems, if you have systems, they'll cover maybe one hospitals or two. But now I have some systems I work with sometimes dozens or hundreds of locations outside, right? Clinics, laboratories, and so on. How do you kind of bring all that information, once again, in an automated way into one place? And then ultimately, what you need to look for, as I said before, in the right place, right person, right time, an actionable and prioritized recommendation, right? If I just give you data and you don't have anything to do with that, or you now need to spend another hour or two, that's not enough. It has to be fast, it has to be actionable, and it has to be prioritized. So you need to know what to do first. One of the best tools for that, okay, and going back to artificial intelligence, and once again, there's a lot of things around analytics. Analytics is a big word, but I really like this definition from Hal Varian from Google. The ability to take data, understand it, process it, extract value, visualize, because that's how we're visual people, and communicate it, right? So we can do something about it. So once again, the new AI tools now take this huge amount of data, right? And that's part of this automation, just to give an example. and are able to extract value that we've been never able to extract before, right? Just because physically we can't get that amount of data, into our minds. But using machine learning, using deep learning, I won't go into an AI discussion here, but that's one of the best tools we have today, and we must take advantage of it. And a lot of vendors take advantage, and so do we. And I'll show you some examples. And lastly, I call this visibility, and the reason I call this, and this is going back to any one of the industries we've talked about that I mentioned last a couple of slides before, you cannot manage what you don't see. So visibility is so critical, and especially in a hospital environment. And I like this picture because there's so many people, there's so many roles, and everyone either has some, a handheld device, an iPhone, there's a medical device, there's, building devices, there's elevators, there's so many things going on, but without getting the right visibility, we can't do anything about it, because if we don't get visibility, we don't get the analytics, and we can't automate it. Okay, so this is, to me, one of the very most basic points, and I'll keep talking about it in some of the use cases. But just to give you some numbers, at least with some of our customers, when we go in and we ask them, what is your device count, or what you think you have, at least in 20% of the times, I still see customers using Excel, to track their devices. In probably 40% of the cases, this information is in different departments, in different silos. And therefore, once again, going back, you can't manage what you don't see. So if you don't see all of them, you'll definitely get a blind spot. We'll talk about this. So once again, when we're talking about a solution, guys, you need to look for a solution that understands your environment, that can look for things all over your, it's like a wide coverage, as I mentioned before, all over your facilities. You want it to be very granular, right? You can't say, well, I have 500 infusion pumps. That's nice, but we'll talk about it in a second. If you don't know what they are, or what version they are, and what type, it's not that helpful when you come in, if you need to troubleshoot or fix or patch them. And that's why the granularity is very, very important. You want to have an idea of the data flows and how it relates to your own workflow. So where is the data coming from? It's coming from a nurse station or a workstation of a doctor, and going to a CT, and then going from that CT into a PACS server, and there from the EHR, and so on. That level of understanding, we'll see this in one of the cases, the use cases. And then lastly, where it is, right? Where is the location? Sometimes you know where it is, sometimes you don't. So things like when it was first seen, when it did come on the network, when it was last seen, because sometimes devices get lost. Unfortunately, it's also stolen. You want to know where it was last seen, first seen, and help you to find that and identify that device where it is. So with that said, I want to move just one more thing before we jump into the use cases. The solution, or any type of solution, and that goes back to breaking the silos, has to be integrative. And when I say integrative, I'm talking more now on IT. The more systems talk to each other, or the more integration there is between systems, the better the information here, and it's cleaner, right? Because otherwise we always get into the garbage in, garbage out problem. So systems like ours, at CyberMDX, we spend a lot of time making sure we integrate with as many systems as possible, because for us, it's the 1 + 1 = 11. That's the level of leverage that we want to get. So we want to be able to, make sure that the information we have and we present is the same one that is in your CMDB or inventory or CMMS, right? So we can send alerts into a system. Let's say if you have a security system, so you get the right alerts at the right time. Once again, going back to that automation I talked before, making sure work orders are sent correctly inside the CMMS, the location is there, get security information or share security information with firewalls and NACs, so in case there is an attack or there is a threat, the firewalls know about this, and we can prescribe the right policy to prevent that. And as I mentioned before, using BI and analytics tools like reports to get that information out and visualize it in a way that is usable. So with that said, let me jump into some use cases and how we see in the field unlocking this potential that we get from analytics and from insights. So as I said before, one of the biggest thing, and I'm now, probably spend maybe one webinar just on this, is around troubleshooting, because this is the day-to-day. And once again, the last couple of conferences I've been in with HCM and talking to some of our, customers, I kind of found out, HCM people are nearly all day running around and doing troubleshooting. So I'm really looking for ways to help them. And one of the things that came up a lot, in my discussions, is that people say, well, someone's saying there's a problem, but I can't find it. And the reasons it's very hard to find a lot of the devices today, and I don't have percentages, but my kind of gut feeling, we're talking about somewhere between 20 to 40 devices, percentage of devices in the hospital that are serial devices. When I say serial, most of you probably know what it is, but this is kind of devices that connect with an RJ or RS-232 connection into a terminal server. And the reason I'm mentioning it because most of our networks today are Ethernet-based networks, and they talk using IP. And what it means, once we have IP network and serial devices don't have IP, they need to work behind a network mediator, whether it's a terminal server or a gateway. And a couple of issues arise here, right? The first one is if you just look from a network perspective, you only see one IP. Now, sometimes there's a dozen devices behind that IP, and being able to see behind that IP, this is something we spend a lot of time on, and to allow you to see what's going on. The second thing, these devices are extremely vulnerable. These are 20 or 30 years type technologies sometimes behind that, and therefore they don't have built-in security. So if somehow this is, these devices get affected somehow, it's, you need to be more aware of that. Just to add to this, sometimes the gateway itself is vulnerable. So now if we have one terminal server or one gateway that's vulnerable, it can easily infect dozens or sometimes hundreds of devices at the same time. And then lastly, once again, when people are telling me we need to find something to patch it or to take care of it, knowing which serial device is connected to which terminal server, it's easier to find them, because the terminal server, we can find them if they're on an IP network. So with that said, I'm going to ask Linda to please run the first poll for us and see what do you guys do for your locations.
Okay, Safi, yes, I have launched it, so people are responding. So the question is, the biomed in your organization tasked with providing asset utilization metrics, yes or no? So we just give it a couple more seconds before I close the poll. Okay, I'm going to close the poll. Okay, and we have 44% at yes and 56% at no, Safi.
Okay, that's great, because it fits to my couple of next slides, and It's interesting, 4% yes and 66% no. So I wonder, and once again, we can maybe touch on it later, who is in charge of doing, of getting these metrics? And my guess is that, as I said before, everyone wants them, but there's no specific area, to get them, or once again, there's no point, a center point to gather all of this. The good news, once again, as I'll show you very soon, is that there are great solutions for this, and we provide a lot of analytics. So the next thing around troubleshooting, and once again, this came from 2 different hospitals I've worked with now for a couple months, is one of the things that come up is a doctor will say, well, I don't see the data of my patient in the EMR or EHR or the Epic. We just sent a CT scan or something like that. Why is it going there? So once again, a problem for, biomed team will get called, or HTM person will get called, but automatically, if that's happening, they'll need to contact someone from IT. So, questions: why isn't the data getting to HR? Is the device still connected to the right servers, right? What type of connection? Did sometimes, people, even the cleaners, just unconnect or unplug the devices and then maybe plug it to the wrong plug in the wall? Of course, misconfigurations, a lot of them today, by the way, for new devices are reported automatically, and we can pick it up. Malfunctions are reported, a lot of them automatically. We can pick it up and let you know. But being able to see that data flow, right? Is it coming from a mobile phone, a nurse call system, a monitor, and how it's going up, and which devices are connected on the way, and how the workflow of this data is visualizing it, which we do a lot, is very, very critical for everyone to solve this problem, because once again, we can locate where the issue is and easier to solve it. So once again, a system needs to have all of this. It all needs to automatically come up. By the way, a recent example was, which was more on the security side, but very interesting to me, was that we found that a lot of these medical devices are running on guest network, right? So one of the biggest no-nos, right, today in cybersecurity, you don't want a medical device with PHI running on guest network, but following that workflow and that data flow, we were able to identify these devices on the guest network. The other one, which I found very interesting, is that in some cases there was no, because of the segmentation, and I'm using some words here from the cybersecurity, but basically different VLANs that the IT people are using to protect networks, which are very, very important tool. Because of the segmentation, sometimes devices are basically cut off each other. And so when some of our customers, where they're doing their segmentation projects, some of their devices are then getting disconnected, and the data is not flowing to the right, PAC server and so on. So this is around troubleshooting. Another one that I like is this, where are the devices? So we have here an example of a glucometer where it has 4 ways to connect. 2, which most of them are connected, I see in hospitals, wirelessly, which that's how they work. But we had this case where with one of our customers, there was a problem with one of their glucometers. They needed a patch and they couldn't find it. And what we helped them do is we found that actually this one was connected directly to the workstation through a USB connection. So once again, it appeared on the network as a workstation, but really this is a glucometer with the same issues and vulnerabilities that's just was connecting through a USB port. And I know a lot of you are having USB challenges, but that's a very, very, once again, important and interesting use case where understanding the protocols of the network data that's running helps us find these devices in places where you can't imagine they are, or sometimes they're not supposed to be according to your network policies. Another use cases, and that's kind of happening day in and day out, patching vulnerabilities. So this is the last, big vulnerability. There's been a lot of noise about this. Bluekeep, finding which devices are vulnerable to this, understanding what are the number total of devices that could be affected, how many of them are medical devices, how many have depreciated operating system, which I'll touch again soon, and how many have open RDP port. And the reason I'm saying this, that we have one customer that has thousands of these devices that are vulnerable to this Bluekeep, and you say, oh my God, I need to go and now patch thousands of devices to do something. But guess what? If we find, and we'll tell you that only out of these 1,000, only 50 or 5 have their port open, that means these are the ones you need to do first. And if you do them, you probably are in a very good place to now put a program together and not be exposed to something like a WannaCry or some other types of infections that can shut down a hospital. So understanding the context is very, very important, and that's something that we can provide in helping you take action and prioritize it, as I mentioned before. Another use case I see a lot is using devices for replacement. So what we see in many cases, there's devices in high risk, but once again, high utilization. You need to patch it, you need to fix it, there's something things you need to do. But we also see the same type of device with high risk. You can think about XP based devices which are rarely utilized, or very low utilization rates, so they don't add a lot of benefit. These are the first one to replace. So if I need to do we have a replacement project, look for these devices that are not that utilized, and sometimes you'll find them in it's like in your inventory or somewhere that you can identify them and use these ones as the first replacement targets. Another use case, lowering, or in some cases eliminating rental and lease expenditures. And I see this most happening with seasonal type assets that we bring in. So hospitals, during the winter will have more of some type of devices. In the summer will have different type. So they typically, a lot of them use rental or lease. But what happens a lot of times, they just bring it in the winter and just stays there for the entire year. So once again, analytics like this one, which tells you how much you have in inventory, you can see how much you use on a daily basis or a seasonal basis. And when the season is off, just return these devices and don't hold it. Remember, every time you hold devices, there's compliance costs, there's maintenance costs, there's all of these costs that you need to factor in. Once again, we're talking about billions of dollars over our entire industry. A related case, how do you identify shortages or overstocking? So being able to see, like, once again, in this case, how your devices are allocated over several sites. You can see that some sites only use 40% or 50% of their devices, and some sites use 80 or 100%. So once again, how can we shift from one location into another? Another use case I've seen a lot happening is when new hospitals or facilities are being acquired or inside the system, doing this initial inventory and understanding what you have more or less. So you might use the inventory from a new acquired hospital or system to add to your current one, or use whatever excess inventory to add to another system or clinic that you just built. So once again, helping with the reduction in costs and acquisition costs. Another one is using these analytics that we show you here in the decisions of procurement. So one of the things I like a lot is you start getting information of how many hours you use each device, and once again, getting it into a bigger picture, into a bigger context, you can make better decisions on, do I really need to procure, right? I know, I don't know, the radiation department is asking me for, new CT or a new asset, but then again, in another department, I see that that same asset is only used 2 hours a day, and therefore we can do better utilization. When we come times to maintain and patch devices, that once again is typically a challenge for many hospitals, and especially HTM departments. So identifying these times where these things are not used, as patients are not connected to them, or doctors are not using them, and this is the time to take it out for maintenance, whether it's for a couple of hours or days. Being able to, as I mentioned before, visualize it in a very simple way and automatically get that picture, and make these decisions, doing it at the right time, at the right place, without interfering with the ongoing workflow of the hospital. Again, decommission decisions, I'm going here to the life cycle, right? We talked about procurement, we talked about maintenance. Now, typically a last part is the decommission. Which devices do you want to decommission first? So, we always provide you with alerts around, which systems are at end of life. Sometimes we'll even tell you, just, to make sure this is coming, this end of life is going to be in another couple of months or another year. Start embedding this into your decision process, and making sure this is going here. So Linda, can you pull the last poll for me, please, before we kind of get into the summary?
Okay, so you want the question, does your organization use device utilization poll?
Yep.
Okay, hang on a second. Right, I am now launching it. So, does your organization use device utilization analytics to make product lifecycle decisions? Is it a yes, a no, or a don't know? So we'll just give it a couple more seconds, and then I will close out the poll. Okay, let's close it now. Okay, Safi, you have 36% at yes, 43% at no, and 21% that don't know.
Okay. Once again, very, very interesting. I can't say this is something that I wasn't expecting. But once again, I think that goes back to what I initially said. I think there are a lot of technologies, and in our industry, we don't use them enough. And the fact that only a third of our customers here said yes, and of course this is just a random poll, but I don't think this is far away from where the industry averages are. And I think once again that there's more room to use analytics in making these decisions. So with that said, I want to leave some time for questions. So let me get into the last two slides here. So sorry, mentioned depreciated operating. So I just want to kind of go back. We all need to do more with less, right? So there's more things happening, more M&A, more IoT, with less budget, less resources. Ultimately, and this is, I go back to this, we should not forget, and I'm sure you guys live this and it's in your blood, but ultimately we're trying to give, better care with a higher safety. So how do we do more with less? These are the three things that I mentioned, right? Using automation, analytics, getting good visibility, and in summary, we kind of put it in like this perceive, plan, prevent kind of thing. But really, we want to get that 360 degrees visibility, which provides the protection, the intelligence for healthcare assets, connected, because that's where we're in, but also any type of asset that you have. By understanding what we can do, putting in the effective policies, procedures, governance, we can, I think, make a huge leap from where we are today to the next step. And I don't think it takes a lot, right? So we're talking about, the perceive, right? So how do we get from kind of inventory that it's unknown or not clear what we have there, to a place where now we can see 24/7 devices that are coming on, coming off, where they are, start using metrics and analytics, as I said before, to measure ourselves, put procedures in place, put governance, and have teams kind of see the same picture. The prevention, once again, I'm going back to the cybersecurity, or to in this case, how do we prevent things from happening? Once again, if we have a prioritized risk assessment, putting things into context, right? In our case, how do we microsegment for security, using AI, artificial intelligence, as I mentioned before, either for security, like we do for detection threat or containment of attacks, or using AI for better analytics and analyzing these huge amounts of data to get a better picture. And then our plan part, how do we move from, and we asked this maintenance question before, how do we move from being more reactive to being more strategic and more proactive? And that's, once again, that's these new technologies that I just mentioned in my presentation, and these use cases that help us, improve our day-to-day activities, whether it's troubleshooting or finding devices or procuring better, and improving by these things, our reliability and effectiveness of our assets, and ultimately a better care for the entire organization. So I know we have a couple of minutes, so I want to stop here, and I'll take questions, and thank you very much for your time today.
Okay, that's great. Thank you, Safi. Yes, we've got a couple of questions. I've got one here. Can you explain how this solution integrates with CMS solutions?
CMS, sure. I think the integrations, as I mentioned before, are critical. The way most CMMS, the newer CMMS systems today, all integrate using APIs, and that goes to all systems. And I just want to maybe stress that the CMMS is critical because of work orders and because of HCM, and basically HCM professional manage their day-to-day, the ones that run CMMS, which I think today is probably a big portion of the customers that we see today. And being able to integrate the information, and finding, serial numbers, MAC addresses, IPs, and locations, and having one point of truth is critical. Like I said, today these integrations are very fast. All new technologies use APIs, and like I said, it's really a mapping session and design session, and from then on, it's just sometimes not more than a week's work to get a good integration.
Okay, that's great. Another question here: is Cyber MDX able to detect vulnerabilities down to the firmware?
Yes, the answer is yes. Once again, getting back to that visibility, so the ability to see all of the parameters of the device, including, like I said, the firmware, the operating system, is critical, because sometimes you have, like I said, 500 or 5,000 IV pumps or monitors or something like that, and they will be from different years, different types, different ranges, different manufacturers. Being able to see that makes the whole difference in doing the right thing at the right time, and especially when there is an attack or there is a vulnerability that's out there, finding the ones and having that context of which ones are vulnerable, which ones are more vulnerable than others, is critical. So the answer is yes, and the thing I want to stress is the context is very, very important. So make sure that you understand, what the context is for each one of these devices and the firmware they're running on.
Okay, that's great. We've got time for about one more question. How do you determine when equipment is being utilized versus just turned on?
That's a good question. Our system, specifically when we see data flowing, we know that it's being utilized because, if it's just turned on, and once again, that's a deep understanding of medical device and healthcare. If it's just turned on, it might send a signal that, I'm kind of, we call it a live signal, I'm on. But because we see we do a deep packet analysis and we see what type of data is running, so we can say that now this equipment is actually sending information either to the right PAC system or to let's say the vendor system, which is just for analysis, is a different on or different usage than it is sending the same information, an imaging device is sending information to a PAC system. So in this case, it's actually being utilized. So we can tell that level. We are working on ways to be actually more accurate on that. Like I said, to be able to say, oh, this is, it's been used for the last hour for patching and not for scanning. So we are going to get even better with that, but we can tell today, and like I said, we're going to be better tomorrow. So like in probably by the end of the year, to give you a really good analysis of not only how much the device is used, but what it's used for. So great question.
Great. Okay, well, we're coming up to our hour's allocation. So thank you so much, Safi, for a great and informative webinar again. And thank you, obviously, to today's sponsors, CyberMDX. Just a quick reminder that we have now automated the post-webinar survey and certificate process, and hope that you'll find it more convenient. The survey link will be included in the follow-up email, which you will receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. One lucky attendee will win an Amazon gift card for completing the survey as usual. If you have any questions, please contact us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. So thanks once again for everybody joining us again, and obviously thank you again, Safi and CyberMDX. Enjoy the rest of your day, and we hope to see you again next week.
Thank you, Linda. Thanks, everyone. Have a good day.